Well, good afternoon. Hello and welcome to our Ontario Network of CAPC CPNP Projects webinar event today. My name is Sydney Bell. I'm the network program lead, and I'm really delighted to welcome you here along with our guest speaker, Angela Geddes. But before we say hello to Angela and move into her presentation, I would like to just take a moment to begin our gathering today by acknowledging the work that we do in communities across Ontario is on Aboriginal land that has been inhabited by Indigenous peoples from the beginning. And for those of us who are here as settlers, we acknowledge this recognition is an important but first step in our collective commitment to make the promise to the challenge of truth and reconciliation real in our communities, and in particular to ensure equitable access to care and services to Indigenous children and families across the province. And so with that, I want to again welcome you to this event. The title of today's session is A Complicated and Beautiful Brain, an opportunity for us to do more to reduce the incidence and the impacts of prenatal alcohol exposure and fetal alcohol spectrum disorder, FASD. And we have with us Angela Geddes. And Angela, I'm sure will share more about herself, but what I'll tell you is that she's currently in private practice with FASD and trauma-informed clinicians, providing education, advocacy, assessment, and direct support for individuals and families experiencing complex mental health and developmental issues, including the impacts of PAE, FASD. So we're really delighted to have Angela with us. Hello, Angela, and welcome.
Hi, thank you so much.
Hi. I wanted to mention before you begin just about questions that certainly we'll have maybe a space at the end for a Q&A. But if you do have questions in the meantime, feel free to pop them in the chat. And I also want to mention, I think Angela will share about a book that she has put out into the world, and I'll let her tell you more about that book. But I just wanted to mention that we're going to give away 2 copies of the book at the end of the session today. So there'll be a couple of quiz questions. So just inviting you to pay attention and to be with us at the end of the session. So I think that's all I have to say, and let's hand things over to Angela, and I know we're all excited to hear what she's going to share with us. Thanks, Angela.
Right, thank you so much. Can you hear me okay?
Yes, yeah. I hear you. Good, yeah.
Okay, awesome. Yeah, thanks so much for the invitation to be here. I'm just so honored to share space with so many of you who are obviously very committed to improving outcomes for some of our most vulnerable, but certainly those that you know, are in our early years, right, and their families. So I do think that this is a tremendous opportunity. I feel like communities are kind of bubbling, and there's some opportunity for us to really challenge ourselves to look at ways that we can do things a little bit differently. And I think it's Diane Malbin, for those of you who've done some FASD training in the past, she always says it's not about working harder, it's about working differently. And that's the goal here today, is to explore opportunities for us to possibly do things differently so that we can be a little bit more inclusive and a little more holistic in terms of what we're seeing in front of us. Sorry, I'm trying to, there we go. So I really think that, you know, Maya Angelou said it best when she said, do the best you can until you know better. And then when you do know better, we can, when you know better, we can do better. So a little bit more about me. I am in private practice right now, but I've spent over 25, almost 30 years working in the field. And I like to start with this quote, and I like to start with a bit of an underpinning to help you understand where I've come from. So the very first professional experience that I ever had was with a little fella who at the time was diagnosed with fetal alcohol syndrome. And so for those of you who've been in, like I said, at this for a while, that's not even a diagnostic term anymore, but it used to be used to describe individuals who were visibly interfered with in their development by prenatal alcohol exposure. So that means that this little fella had the facial features, and in his case, he had significant health issues, and he was quite small and visibly, like I said, very impaired. So the bad news for this fella was that he was exposed to a significant amount of alcohol that resulted in a full body experience, and one that we could recognize. The good news was that he was exposed to enough alcohol that he was visibly able for us to recognize. So in other words, and I know that's odd because we never want to see, it's never good news that individuals are exposed to significant amounts of alcohol. But the good news in his case is that we, as a service provider and service delivery system, recognized that this little guy, we needed to change our expectations. We needed to adapt and make accommodations and modifications to everything from education to parenting support to his healthcare. So we knew to wrap around him, in other words. And so when I fast forward into the next stage of my career, I mean, like I said, he was visible. So I was imprinted very, very early on with the distinct understanding that alcohol in pregnancies was not a good idea. But I misunderstood the degree of which even small amounts of alcohol can impact pregnancies. And I didn't understand that FASD was not reserved for families that really struggled with either mental health or addictions. So that was our understanding at the time, that we knew that alcohol wasn't good for pregnancies, but we didn't know that small amounts would make a difference, or moderate amounts would make a difference. So again, that imprinting was good for me, but it also meant that when you fast forward the next 10 to 15 years of my career, before I took a deeper dive into prenatal alcohol exposure and FASD, there were a lot of people that I supported in ways that were not holistic and not inclusive of these unique and subtle nuances. So, but all of us are in this field to do the best that we can do. And we want to improve outcomes, and we want to make sure that we lighten the load for families and for individuals who are struggling. So again, when we know better, we can do better. And that's what I'm hoping that we get to do today. So from that early experience working as a child and youth worker, I continued to work in a variety of different group homes and foster homes and facilities to support individuals who were involved with the justice system. And then I moved on to community health centers and worked in early years programs that were specifically designed to address, higher risk situations in families. So I see that, many of us here today are working in those early years and trying to, provide early interventions and prevention opportunities so that kids and families do better. So I did that at a community health center for many years, and part of my role there was to sit on a committee that talked about the risks associated with alcohol use. And so then it didn't take long for us to kind of veer off into the role of prenatal health and alcohol and the impacts there. And so then, as part of my work, I would work with young moms or young people who were struggling, and we really tried to make sure that it was not just moms; it was moms and dads and aunties and grandmas and families that were supporting little people. So we built that program, and we did a lot of teaching within it. And it was fascinating to me because on September the 9th, we always worked towards educating the communities around International FASD Awareness Day and our attempts in a very small community to build awareness. And so I would get the participants of the group to create the learning opportunities to share with the community. And it was fascinating to me, within the safety of that group environment where relationships were well established and we met on a regular basis and we just discussed the education materials It was amazing to me how many of my families self-disclosed around pregnancies that they were unaware of until many weeks or even months into it. They were readily able to explain to me that alcohol or other substances were a part of their histories. And some of them are saying, oh my goodness, I think this might be why my children are struggling in school, or my children are struggling with behaviors that are odd or puzzling to me. So again, I learned a lot in those environments around the impact, and it just kept coming up and up and up, where pregnancies were exposed, behaviors were challenging, we were sending folks to parenting classes, and the outcomes were not improving. So from there, I went back to school to try to figure out the role between parents, families, community, and school, and really focused on that to kind of bridge that gap a little bit. And then eventually I went back to get my master's degree in social work, which allows me to do the private practice. And I guess I can say I wrote my first book there, which was a thesis that focused on, FASD and building sustainable assessment and support services throughout Ontario. So yeah, that was quite an experience for me, but I learned through working at a pilot project where I was the coordinator of an FASD assessment clinic. I learned early on that the need for diagnosis far outweighs our current capacity. And we'll go into the statistics a little bit more in a little bit, but it didn't take me very long to learn that we needed to do better and we needed to do things differently, because I really felt like I spent more time on the phone with families saying, I'm sorry, we don't have room for you. I'm sorry, we'll have to put you on a wait list. I'm sorry, I don't have any services that are local, that are FASD informed for you. So I guess we're going to have to create some. And so we created a support group in our little community. And at one point, and diagnosis was not necessary, suspect of FASD was necessary. And we had over 30 moms and dads and caregivers at one point, and we had over 30 kids. So that was an amazing partnership. But at least families had a place to go to learn that they weren't alone, and that there were things they could start doing immediately, even without a diagnosis, that would improve their circumstances at home. So that was the goal there. And yeah, proud to say that that group is still going, even though I'm not there anymore. But so again, thanks so much for joining us and being committed to digging a little deeper. And again, the goal is to reduce both the impact and the incidences, because every time we have conversations around this, particularly in our own circles, we have the opportunity to make a difference and really have some aha moments. So we've already done a land acknowledgement, so I won't repeat that, but I just want us all to take a moment and really, express gratitude for the land that we're on. But I also think that it's important for us to particularly focus on truth and reconciliation and how we can make that real in our communities, in particular to call to action number 33 and number 34, which both focus on prevention and our need to support people in the justice system differently. And although this is specific to, obviously our First Nations and truth and reconciliation, but this is way bigger than this. We know that FASD is an indiscriminate condition, and there's opportunities for us to do more in terms of prevention and awareness, and certainly, those pockets of our communities where FASD is overrepresented. So again, the purpose of today is how can we do things differently to support healthy pregnancies? What else can we do? I want us to look, I'm just going to let my dog out just one second. I also want us to look beyond typical parenting problems and behavioral difficulties and things like trauma and attachment. So I don't want us to forget about these things, obviously, because they're very critical, but I want us to dig deeper and look beyond mental health and addictions to say, how can we be more holistic and inclusive, and challenging our own understanding of what we know. Because, when I hear people say, oh yeah, I know all about FASD, I know for sure they don't know all about FASD, because we're all just always learning. We're just always learning. The research is not It is changing for sure, but we have tons of research to tell us what we need to know. But we also have to understand that everybody with FASD is different. And I'm here to say that our research is incomplete. As much as we have good evidence that this is real and the risks are real and what people struggle with in terms of FASD is real, it's incomplete. It's incomplete because there are so many people with FASD that don't know they have FASD. So obviously they're not included in the research. And that's way more than the people that we do know. So I don't know if that surprises anybody, but I've got some statistics that will back that up a little bit more in the presentation. But I really want us to think about that for a minute. And so when we say things like 90% of people with FASD will not live independently, we can't say that. We can say that the ones that we know of who have been struggling enough to be identified and admitted into the very few diagnostic opportunities that there are across Ontario in particular, but across the globe. So just think about that for a minute or two. You know, I mean, the diagnosis criteria does not change, but the prevalence rates are way higher than what we ever understood them to be. And most people with FASD don't know it. So this is my little brag book opportunity, but I also take a minute to really draw on the energy in the group because I have some big ideas around how we can keep changing the narrative around FASD, challenging our biases around FASD, and also increasing awareness around our kitchen tables and around our own personal circles. So we'll talk about that. But Dr. Peter Choate is a professor in Alberta at Mount Albert University, I believe. I hope I've got that right. Sometimes I second guess myself when I'm in the middle of a presentation, so sorry about that. But Dr. Peter Choate is amazing. I've had the honor of presenting with him in the past, and he recommended my book. He said some really nice things about it, and he recommended my book along with Dr. Bruce Perry and Oprah Winfrey's book that's called What Happened to You, which is a phenomenal book. I recommend that everybody read it as well. But I just kind of throw it out here all the time because I have a dream that I'm gonna meet them someday, and I'm gonna be able to have a conversation around how the intersection between trauma and prenatal substance exposures, and how we need to, again, broaden our audience around that and have more, deeper conversations around what we think is trauma in some cases and how it's actually trauma plus, developmental trauma as a result of these exposures. So that's my opportunity to kind of share. As Sydney said, there are going to be some books available. I'm really, really proud to say that my book is becoming part of post-secondary education. Very proud to say that I'm a part of, imprinting these young child and youth workers, or what I call helpers of all kinds, as they embark upon their career. So they don't spend 10 or 15 years like I did, not clear around who met criteria and what people might be struggling with, and how we kind of attribute a lot of things to poor decision making and poor parenting. We can sometimes, perpetuate trauma and do a lot of damage in our efforts to do good. So yeah, I'm really, really proud about that. I just was there last week, in fact, for another course, and it was amazing because there was a student who sent me a note after the presentation, and he indicated that he read the book even before he started school, which I thought was pretty indicative of how committed he is to the helping profession. But he read the book, and he was a summer camp counselor this year. And he said that it made a profound difference on his approach with kids who needed to have kind of reminders, or kids that just weren't grasping things and needed to be shown and redirected on a more consistent basis. And what he said to me that warms my heart was, he said it didn't necessarily change the behavior right away in that context, in that time frame, but he said it certainly did change the campers' experience, and that they had happier days, and that his approach was different. He offered more compassion and tolerance and time to make necessary accommodations. So the camping experience had improved, and you know, the kids' view of camp and view of themselves within it improved. So for me, that's a game changer, and that's a win. He also went on to say that in his family, there is a person that knew that there had been exposures, but because there were no visible signs, people kind of dismissed that and chalked it up to other things. But he said, now that I've read the book and I shared my knowledge in a, you know, in a kind, compassionate way, just speaking about things that the family already knew with a little bit more clarity, they are pursuing now supports that are specific around assessment and for fetal alcohol spectrum disorder. And so, yeah, so that was a really positive experience, and one that I thought I would share because it's all about, again, broadening our audience and making sure that there are fewer wrong doors for people, and people feel like they're more understood. And that's something that I think we all need. And again, for all of us in the helping profession, particularly working with young families, why should we be concerned? Well, because substance use during pregnancy is actually increasing. So it's gone from 1 to 13 at one point, and 1 to 9, 10 years later, and now we're at 1 in 7 are admitting to alcohol use during pregnancy. And I have a family member who's expecting a baby right now, and she was dumbfounded by that statistic. And I guess if I've done nothing in terms of prevention, I have in one particular case, because I know that she's been planning this pregnancy for months, and have been, both her and her husband have been alcohol free as a result, you know, with my discussions around some of these things. So my poor family has become relative knowledgeable people in this field, whether they want to be or not. But she also has sent me a couple of alarming, what do I say, kind of information or misinformation, a couple of examples of misinformation that she's been shared throughout her pregnancy journey. And I don't have the name of the app, but I don't think it matters, because I think it happens in more than one of them. But she has a pregnancy app where she follows her pregnancy, sends me little pictures of fruit around how big the baby is at this point in time and what's developing. It's adorable, it's lovely. And it talks about the risks associated with alcohol use in pregnancy, but it does so in a very permissive way. So, for example, it talks about, well, you know, the medical community is kind of overly concerned, and they have to be overly cautious around the risks but if you have any questions or concerns around alcohol use, just talk to your doctor. To me, that's very permissive, and it's very misleading, and it just undermines the significant risk associated with it. You know, it's just, again, I just read it to be quite permissive, recognizing my own bias and how adamant I am around giving people accurate information so that they can make decisions, you know, based on what they feel is right for them. I just don't think it's okay for us to be giving misinformation. And she also shared with me a snapshot of a book that she was reading that actually went so far as to, and I think most of us in this field have heard about the one study that spoke about the possible positive results, I guess, or positive outcomes for babies born to parents who drink just a little bit, like small amounts of alcohol, like a glass of wine a day, for example. And when they did this study that was, you know, full of boo-boos, I suppose, but she published the study to say that actually, you know, we can be looking at reducing risk for kids if we drink a little bit. And that to me just makes no sense whatsoever. But it was written in a book, and my niece shared it with me again. And she said, I'm sure you've already heard of this, but I just wanted to let you know again. And of course, it infuriates me because we know that alcohol doesn't do us any good as adults. You know, it's not, there's nothing nutritionally valuable about it. It may, you know, reduce a little tension once in a while, and obviously people use it for medicine for a reason. but we know that the outcomes or the long-term outcomes are negative. So I just don't understand why people would, share that information. So we have to be very careful. And I hear it all the time, even in our little communities where physicians are still saying a glass of wine a day is okay. And I guess I'm here to say that we have a responsibility to make sure that we're giving people accurate information. And that's not okay. We know the research is very clear that even 1 to 2 drinks affects cell development. So, the criteria for the Canadian guidelines for diagnosis just indicate that 2 binge drinks throughout the pregnancy is enough to cause fetal alcohol spectrum disorder. And 2 binge drinks is not that much when you consider standard drinks. That's 4, at a time. When you consider a glass of wine, a standard drink is probably most of but 5 ounces. It's very rare, even when you go to a restaurant, that you get 5 ounces. You get 6, or you get 8, you get 9, or you get 10, which means you're drinking 2 glasses of wine in one. And then maybe if you have another one, that's your binge drink, right? So there's a lot that we need to share amongst our circles. And we're also seeing an increase in children's mental health, and prenatal health matters. So there is a need for us to do things differently, and again, to broaden our audience. So I have participated in many fetal alcohol spectrum disorder specific conferences, which I will continue to do. But I'm also interested in, again, expanding that. So I just recently attended the Children's Mental Health Ontario Conference in Toronto. And there were over 600 clinicians and amazing presentations and keynote speaks that were really, really positive. But I knew going into it, children's mental health is really not the place for people with fetal alcohol spectrum disorder to go, unfortunately. But they're going anyway. They just don't know they have the condition yet. And in my 2 days of being at this conference, I heard fetal alcohol spectrum disorder once, and it was in a keynote presentation. I was so grateful from the CEO of Children's Infant Mental Health Promotion Program out of, what hospital is it? Oh my gosh, my memory. It's in Toronto. Sick Kids, actually. It's at Sick Kids Hospital in Toronto. Privately funded program or fundraised program within that hospital. And they mentioned the importance of prenatal health and the role of prenatal exposures and how that impacts mental health across the lifespan. But that was just mentioned once. And I selected my workshops that I attended. I did a poster session bringing awareness to fetal alcohol spectrum disorder. But the workshops that I attended were specifically addressing very complex needs and kids that are using the term extensive services now rather than complex. And they listed all kinds of conditions that little people and youth can have, everything from obviously anxiety, depression, personality stuff, autism, ADHD, ODD, OCD, like all kinds of CP, like all kinds of conditions across the whole screen on a big chart, and FASD was not mentioned. And this might surprise you guys. It certainly did me. In fact, it made me sad, quite frankly. But when I posed a question in this session saying, given that the prevalence rates are so much higher than, many of these other conditions, I'm curious to know what we do when we screen and identify, or if we screen and identify for a fetal alcohol spectrum disorder. And the retort back to me was, I can't quote it exactly, but the retort back was something to the effect that actually the research is saying now that we're overdiagnosing people with FASD, particularly in our First Nations community, and that's due to racism. And I was like, the statistics around who's being diagnosed in this province and in this country are staggeringly low. We're not overrepresenting, we're not overdiagnosing anyone. And that was it. Just she had such an opportunity to raise awareness, but it was kind of stifled. And I knew that if I responded back, it would be kind of a, kind of like a confrontation. Not that I was going to fight or be in a confrontation, but I just knew that that wasn't the venue. So I spoke to her the next day in more detail, and she said that it is about parental advocacy and political will, that autism is a part of children's mental health and FASD isn't, even though the statistics are very clear that the needs are much greater for people with FASD. So let me just see. Okay, so now what I wanted to say here is that there's a couple of articles, and I can share them with Sydney afterwards. I am a social worker in private practice. I have just developed, a 6-module training material for helpers or for social workers in the field to improve our ability to screen and assess. And I stuck specifically to social work in this particular training because that's me staying in my lane. That's who I am and I know the role that we can do within our professions. But I also know that we can insert helping profession here because all of us have a role to play in screening and identifying and being able to put families and individuals on a path of more helpful and relevant supports. So that's why I'm putting this here. And there's a couple of, like I said, a couple of research articles that I will share to help validate. The timing of these articles couldn't have been more perfect. They came out just as I was about ready to launch my training. And they say very clearly that given the prevalence, the severity, and the impact of FASD, there should be more of us, competent and confident. And I can tell you, when I did my thesis, this was overwhelmingly seen, no matter what, like whether you're a nurse, whether you're an OT, whether you're a doctor, people are aware that they do not feel competent in the area of FASD, nor are they confident in their ability to screen and assess. And most of us kind of feel like we need to be specialists in order to support people in a good way. But social workers and all of us in the early years can play a really positive role in prevention and identification. And this article also indicates that this specific training in this area can help us all to fill our potential in our role, which is what we want to do. And we all can be really helpful, even in the absence of a diagnosis. And this is a human rights issue. We are seeing far too many families not have access to service, not have access to the kind of accommodations that their kids need in the classroom in order to be successful. I hear all the time from families that the school's not identifying the same kind of problems. So when home becomes unmanageable or really, really difficult because of the sensory overload and the expectations placed upon kids and youth throughout the day, when they get home, things kind of go sideways. We as a system tend to blame and shame and attribute these difficulties to relationship or attachment issues. And that's not always the case. These are developmental disabilities, and we all have human rights that we need to adhere to. And the bottom line, we're not doing a very good job. Families are being disrupted, and the outcomes for children in care, we know, are not good. FASD is overrepresented in child welfare, in justice, in our emergency departments, in our homelessness agencies and shelters, in our mental health and addiction services, for sure, without a question. And people are not qualifying for the kind of services they need and are entitled to. And people with FASD don't fit neatly in anywhere. And so what I was saying earlier about FASD and children's mental health, I mean, some of the barriers there is that there's not funding for it, because we're now recognizing FASD as a developmental disability. And so now that FASD projects, which don't include very much direct service, our government has made some investments over the last 5 to maybe 8 years. 2018, I think, is when the initiatives began. And at that time, I was coordinating a couple of them, one of them through Health Nexus, and one of them was the support group project, the website. There's been some investment in prevention initiatives and more assessment services and more education. So there have been investments made, but those, the FASD kind of fits into the Ministry of Children, Community and Social Services, where mental health services are now funded through the Ministry of Health. And there are some committees and some work that's trying to bridge that and make those connections. But you know, when I was doing the support group project, which was only 3 years ago, 2 or 3 years ago, I had, you know, clinical coordinators from lead agencies tell me that their government project supervisors from the ministry told them they cannot offer FASD groups at a children's mental health agency because it's not within their funding pocket. So they couldn't even apply. Some of them couldn't even apply for these funding, these little micro grants that we were offering to support FASD more holistically. So that's a real barrier. And again, that's not consistent. There's a lot of children's mental health agencies that are trying to be more inclusive, but the funding streams are different. So that is a reality that we need to understand. And people with FASD typically have an IQ that's very often over 70, which has limited them from being able to access developmental services as well. So that's where I'm saying that we're just not fitting in very neatly anywhere. And so then, you know, falling through. So people are misunderstood, misdiagnosed, mistreated in many different ways. And so when I finished my thesis, which was just in 2016, at that time, the prevalence rates were low estimated to be 1 in 100. 1% of the population. We now know that it's 4% of the population. So that's a lot. And at the time, like I used to do this math all the time because I knew that at that time we had like 330 Canadians that needed a diagnosis like today, right? So we needed to figure that out. But our current system, which relies on, and so it should, the Canadian guidelines for diagnosis, because they are the most holistic and comprehensive and will set people on the best path. But they're expensive and they're out of reach. And at that time, we had the capacity across Canada to diagnose just a little over 2,000 per year through that method. So in that, I mean, it would take us 170 years back in 2016 to diagnose the number of people who needed one. So again, it's, you know, it doesn't take long to figure out that we don't have the capacity. And even if we had the money, we don't have the clinician capacity. And now we have to multiply that number by 4 or maybe 5. So it's stunning, right? And what's really stunning, and what's not a surprise to those of us who work in the field, is that these individuals are out there. They're not waiting patiently in their bedrooms for us to figure them out. They're already entering the early years programs. Parents are looking for parent support, children's aides involved, because they're really struggling with behaviors that are very hard for them to understand. And people are calling because they're seeing kids at risk. Maybe they're taking off in the middle of the night, for example. I've got a ton of examples. So they're there. They're at daycare where there's, you know, notes going home to parents on a regular basis, referrals to parenting programs, that kind of stuff. We also have to understand that this is a brain injury and that this is essentially an adverse childhood experience of its own because we're being born with the developmental trauma. And this is often compounded then with other more commonly understood adverse childhood experiences like domestic violence or poor nutrition or poverty or lack of education or parental substance use, parental involvement with the law, you know, and neglect, obviously, and abuse and sexual abuse. And all of those things we know impact our health for the long term. But I don't know whether we know how many of the people that we're seeing through this lens of adverse childhood experiences, we don't, like how many of them also have had prenatal alcohol exposure. So I'm also here to say that providing care and support to individuals who may have FASD does fall within our job description. Everyone in the helping profession, we do see and support people every day. And we not only see the littles, and especially in our early years programs, we don't just see the littles, we see intergenerational effects from prenatal exposures and substance use. And so again, the cost of misdiagnosis is just way too high. So if there's any bankers in the room, it's not hard to figure out that this is very, very costly. So when I was a clinic coordinator, we spent a lot of time going through charts and getting collateral information, because we did do a very comprehensive assessment to look back in history to say, how did this person present throughout the years? And in this one particular case, this is before this little person turned 9 years old. Nobody even considered the role of prenatal alcohol exposure. And so this family was at the brink of breakdown. And I can remember the parent saying to me, and if they send me to one more parenting class, I think I'm going to lose my mind. And I will never forget that. And at the time, I was literally a parent educator. So I just, I will never forget it. But look at, I could do the math here, and this is not complete. This is just what I saw, and I did rough, low estimates of what things might cost. But again, it's not just about the financial cost. It's about how many times that family had to tell their story and had to retell their story, and how many times that little person kind of failed at any kind of treatment or support that they got, and how many times the parents felt like they were just the wrong parents for this kid. And in this particular situation too, I think it's important to know that school never saw much of a problem. I mean, this little person did end up with a full FASD diagnosis, and her needs became more apparent in the school system as she got a little bit older, which is very typical, right? The gap widens as expectations increase. But, this family was experiencing all the built up stress throughout the day that came home, and we all chalked it up, or I shouldn't say we all, because I honestly say in this case, I did not see it that way, but typically the system would see this as a parenting issue and not developmental. So, oh shoot, I didn't change this, but the current context again, this should read: prenatal alcohol exposure is the leading cause of developmental disorders, which is FASD, right? It is the leading developmental disorder in the Western world. And it is just important for us to remember that it is higher than autism, cerebral palsy, Down syndrome, and Tourette's combined. So that's the kind of information I shared at the Children's Mental Health Ontario conference and was kind of shut down. I don't know why people don't want to know this, but we aren't as open to hearing that this is a really, really big deal. And I think it's important to note too that Dr. Philip May just finished a paper in October 2021 that indicates that the prevalence rates in a US county was 7.1%. So Dr. Carl Bell was a psychiatrist in Chicago, and he's since passed away. But I did have the opportunity to talk to him when I was doing my research. I actually called his clinic and he called me back. I couldn't believe it. He was the nicest gentleman and just so in it for the right reasons. But in his mental health clinic, he did research within it and targeted over 500 people. So it wasn't a small project. And I think the adults was 47% of them qualified for what would be FASD. And for kids, it was 52 to 53%. So average of 50% of the people entering his facility looking for mental health services actually were struggling with the effects of prenatal exposure. So if that doesn't tell you that we need to do something differently, I'm not sure what will, right? So, and he admitted to me, and it's in there's a hyperlink in the document afterwards, but he writes, there's an article that talks about, I think it's called The Hidden Epidemic. And he acknowledged that when he first learned it, he didn't want to acknowledge this reality that his community was struggling, but his community was also struggling with a lot of other social determinants of health, which include poverty, lack of education, intergenerational trauma, racism, isolation, all of those things that definitely impact us. But what was used as medicine in many cases were substances. And so what we were also seeing was that this was intergenerational, and not just one generation, 2 and 3 generations. And so he was saying it was going to feed right into the idea that Black communities are less capable than others. But he said he had to share it because it wasn't that Black communities are less capable, it's that this Black community and some other Black communities that struggle with other social determinants of health are also impacted by prenatal exposures. And we can't treat trauma in the same way if we don't understand that. So that's, again, there's a hyperlink for more information. This is hot off the press. I'm sorry, it's a little bit blurry because I made it bigger. But Dr. Lana Popova and Audrey McFarland from CAN FASD, Valerie Temple from Surrey Place, Daniela from CAMH as well, Jocelyn Cook is from the Center, where is she? Obstetricians, and obviously a well-renowned researcher, and Larry Bird as well. They completed this project that found that fewer than 2% of the 1.6 million Canadians who have FASD actually know it. So remember, I was doing the math and I said it would take us 170 years to diagnose everybody. I knew that it was bad. I knew that we were not diagnosing everybody that we needed to diagnose, but I didn't know that it was quite like this. And this is like dumbfounding to me. So again, her research isn't published yet, but she's letting me share this first little bit, and it will be published, I'm sure of it, very shortly. But globally, what she found was fewer than 2% actually of the prevalence rates, and she did 2.5 to 4%. So in Canada and in Ontario, it's 0.5% at the going rate at 4% prevalence rates, and it's 0.8% if the prevalence rates are 2.5, which we know and we're pretty confident that it's 4, maybe more. We still know that it's underestimated because getting confirmation of exposure is tricky, as we all know, tricky at times. Other times with relationships, people are very forthcoming, I've learned. But I'm just wondering if anybody's surprised. Maybe we can have a show of hands or something. I don't know whether there's a way to say it, but even I was like emotionally disheartened to see that 0.5% of the Ontarians that qualify for an FASD would know it. So like virtually nobody who has FASD in Ontario knows it. So that's where I'm saying that our statistics aren't complete. When we say that 90% of people won't live independently, or 80% of people will be somehow, I think it's 80%, will be involved with the justice system, either as a perpetrator or a victim. I'm not sure that that's accurate either, right? Because there's so many people who have FASD that are bouncing, I call it kind of bouncing off the Charmin padded guide rails of life, and are, often struggling with interpersonal relationships, or, planning and organizing and keeping with some of their obligations, or, relationship difficulties, employment difficulties. But, I work with people who have master's degrees, who have FASD. I work with people who are incredibly gifted in a lot of areas, in music and theater and the circus and the helping professions. So there's a lot of people out there that have, some other mental health concerns that are very puzzling, that are actually diagnosable as FASD. So this is where we get to the point where, you know, alcohol is a big part of our culture, whether we like it or not. And, you know, some would say that if it was just invented today, it probably wouldn't pass. You know, we probably wouldn't say that it's safe to be consumed at the levels it is and accessible where it is. Alcohol causes a lot of grief and a lot of damage for sure. And people consume alcohol for many, many reasons. And I like to say, and I can speak very clearly from my experience, the families that I support, none of them have intentionally caused harm to another. So that's not what, you know, I really do think that it's important for us to offer compassion and information rather than shame and blame. But I just had a LinkedIn article that came up on my feed this morning, coincidentally. And I've heard from people with lived experience in the past before that they're not really crazy about us making this blanket statement around none of which are to intentionally harm or to cause harm on another or their unborn babies. And so this is obviously a very, very, you know, sensitive topic area. And I'm leaning in this direction that nobody does it on purpose. And that's been my experience for sure. But I've heard from people who have FASD, and they say to me regularly that, yes, we do have to work on reducing the shame and blame, but we also have to tell the truth. And we also have to stop worrying about hurting people's feelings in order to not get us to where we need to be. So we have to be careful around that. And this article this morning said, saying that nobody does this on purpose is kind of like saying that no foster parents have ever done any harm, deliberate harm to their kids. And it made me stop and think about how this would feel if I was exposed to alcohol and living with some of the complexities. And there are many examples where people are given misinformation and people are challenging the information that they do have out there. And that happens in my circle too. So it was just this summer actually where a friend of mine said to me, you know, Ange, it can't be that bad. I mean, all of our parents drank and we're fine. And I'm like, well, first of all, define fine. And secondly, not all of our parents drank, but yes, we do see increased rates in mental health and people who are struggling that could very well be related to alcohol exposure. And this particular person that I'm speaking about actually attended a high school reunion before she was aware of her first pregnancy. And coincidentally, you know, the first pregnancy has been well, let me just say the development has been difficult for this, and the trajectory for this person has been difficult over the years. So I am a friend and not a social worker, so I'm careful around, you know, what I share and what I do. I just try to be as helpful as I possibly can. But I have connected a couple of my friends to developmental services and to different supports that are available based on psychological profile and less about the diagnosis. So again, we can be helpful even without a diagnosis. And we do have to weigh the cost and benefit to, you know, whether or not this is going to be helpful or not, right? So I'm not going to push on a rope. And especially, well, I mean, I think none of us can push on a rope, right? We have to meet people where they're at. And some people are not there yet. And we have to respect that, but yet also try to be as open and as honest and upfront around the risks as we can in the spirit of prevention. So again, it is really tricky. If anybody has any questions or any other scenarios where they want to bring up and challenge me or help me to see things in a different way or help me to see things in a clear way, I'm open to this discussion. We'll have time at the end, but certainly just let me know. So yeah, so I, you know, again, I do have these conversations, and some of my circle is doing better because of some of these conversations. And I also have developed a bit of a podcast, which I'm not really crazy about doing, but I do see the value in it in terms of broadening our audience. And I actually call the podcast Kitchen Table Conversations, because this is where the information, where the learning, the most meaningful learning often takes place, is around the people who love us and care for us. And if the people who love us consumed alcohol during their pregnancy, like my friends, and don't see the connection to some of the difficulties, then they're going to keep saying that alcohol is fine to their kids. And, so no matter what they read in a book, they're going to listen to their parents in most cases, right? So I believe, and the statistics will tell you, that FASD is in all of our circles. If it's in 1 in 25 or 1 in 20, well, those of us who know more people, it's basically the statistics say that there's at least one in every classroom. And where there's alcohol, there can be FASD. So again, this is not reserved for people who struggle with alcohol use. And most people, I will tell you, do not see their drinking habits as alarming or concerning, for that matter, unless they're really in the midst of addiction. So that's why, even when I was the coordinator of the support group project out of Toronto, I would say that, a diagnosis is not necessary. And actually, if you're putting up posters in a library, for example, I wouldn't put FASD as being the big thing, because people will walk right by it. They're not going to think that FASD applies to them, because if you don't have a diagnosis, that's not the one you're going for, right? That's not the one you're going to seek out necessarily, because there is a stigma attached to it. There is that blame, and there is that feeling of guilt and insecurity around that. So instead, let's put posters out that include, let's focus on complex neurodevelopmental conditions or complex mental health and learning challenges, which include ADHD, ASD, FASD, and mental health conditions. Let's just be inclusive around these things, and then let the learning take place within those environments. And so that's what we can do as helpers. But there is an alcohol culture. There's a lot of pressure to drink. I participated with Dr. Lana Popova actually on some curriculum development for elementary and high school students, and was really surprised to hear that when surveyed and asked the question around peer pressure and alcohol use, most adolescents indicated that they wished that alcohol was not at most of the parties, and that they feel obliged to consume it. But I feel like if more people knew that most people at the party didn't really want to drink, they maybe wouldn't drink, right? But most people assume that everybody wants to drink, and they're the odd ones that don't really want to do this. And I can remember my oldest son saying the same thing to me. I wish that it wasn't at every party. I wish there wasn't the expectation that we were supposed to drink. And then there's the wine moms, and there's a lot of research. Dr. Kelly Harding does some research around the media and the wine mom memes and the messages that are sent out all the time, and the marketing that goes directly towards women and young women and alcohol use. And so, yeah, we've all seen the jokes around needing a glass of wine to get through the day. And I used to watch the show This Is Us. And I can remember there was a couple of shows that talked about, prenatal exposures to before the pregnancy was confirmed. I remember, and no big deal about it, no mention of any risks associated. And then there was another very affluent family. I think the mom was a lawyer. The father was a politician, and she, hid a glass of wine in her pantry and would sneak in there during stressful events. So, I mean, it happens all the time. And the messaging around needing a glass of alcohol to get through your parenting day, I mean, I have concerns about that and the impact for a lot of different reasons, not the least of which is, what does it tell our young people, but also obviously the health risks. And then I don't know if anybody has heard of these, but they're like nappy times advertised at local breweries and wine facilities, where they actually advertise and bring in like young, like parenting, parenting groups and nappy hours where people would get together, kind of like you'd go to an early years center to have a play date. And they have them, and they're advertising like breastfeeding rooms and that kind of thing. And I just don't think that they understand the risks even associated with breastfeeding and alcohol consumption. And so, but that's a real thing, where people are going to breweries in the afternoon, having a couple drinks with their friends. And I'm not sure how they're driving their babies home, but they're going home somehow. And I just think that that could be a recipe for disaster. And I'm not here to say that people shouldn't have a glass of wine or a drink once in a while, but there is directly a risk associated with breastfeeding and drinking as well. So, so again, that's speaking to our role of as far as understanding the risks associated. And there are new drinking guidelines that tell us pretty clearly that all levels of alcohol consumption are associated with increased risk, and that's for health risks as well, health and injury. For healthy folks, it's a continuum, so negligible with fewer than 2 standard drinks per week, which is significantly lower than the previous guidelines. Moderate risk being between 3 to 6 standard drinks per week, and increasingly over, every drink beyond that kind of thing increases our risk. So any level of consumption has some risk, but more so with over 2 on any occasion. And I guess 2 is the threshold. And I know with a lot of the people that I work with, if they have 2, there's less of an ability to stop, once they get started at those couple of drinks, then it's kind of like, okay, we're here with a mission. So then the risks associated with behavior and injury, and for any of you who's worked in a hospital, as particularly the emergency departments, like I spent some time after my thesis or after my MSW to do a couple of contract positions in areas of the field that I hadn't worked in before, which were medicine in the hospital, and in community with severely impacted individuals with mental health conditions, chronic and severe. But all you have to do is step into the emergency department for a little while to see the role of alcohol and our crisis situations. So there's a disproportionate risk with men's drinking and injury. But above low levels of alcohol consumption, the risks increase more quickly. The health risks increase more quickly, more profoundly for women. And so for women who are planning a pregnancy, for women who are pregnant, for women who are at risk of an unplanned pregnancy, and for women who are breastfeeding, it is safest to not consume alcohol.
Angela, sorry to interrupt you. If we could go back to that slide. Would you mind saying again, like that when you talk about risk and like say the first bullet point, you're talking sort of generally health risks. Like, could you say more about what that word risk is?
So so my next slide has the QR code to the article itself. So I would encourage everyone, like I'm not an author and I didn't write this, but the risks, what they talk about is when we talk generally about risks, like what you would expose yourself knowingly to, like pollution, for example, the risks there is like 1 in a million chance that you might be impacted by something. Whereas when they talk about risks increasing with alcohol, a lot of the studies go down to like 1 in 1,000 or maybe even 1 in 100 more chances of risk. Do you know what I mean? Does that make sense? So
I guess we're talking about just sort of general health risks, like maybe I don't know, blood pressure, or maybe accidents, my risk of accident. It's quite a general term.
That's right. This is not about pregnancy. In fact,
until the last bullet, right? Then
this last bullet only focused on breastfeeding. I included it because I wanted to make sure that this was not misunderstood. So yes, these are general drinking guidelines for people who are consuming. So it used to be, something like keeping it under 10 drinks per week, I think, for women, and under 15 for men, making sure you have 1 or 2 days that are alcohol free and don't drink more than 2 drinks at a time. I think that's what the guidelines were before this new update. And now what they're saying is that even 2 drinks per week, there's a little bit of an increased risk, but it's a moderate between 3 and 6. So yeah, but I really did want to make sure that I included this last bullet point, just to be clear, because 2 drinks a week would be enough to cause some problems, I would imagine.
Angela, there's been a request of sharing of your slides, just something for you to consider. I know we haven't talked about that, so we can, some people are comfortable sharing their slides and some aren't, but just so you know, the request is there.
Okay, sure. I don't mind. I mean, it just, as long as we kind of keep them as they are, and if you don't mind sourcing me, just letting you use them, but certainly I want this information to get out there. So
okay, great, thanks.
no problem. So again, for me, it's about informed decision making, right? It's not my job to make decisions for anybody else. It's my job, though, to make sure that the information I give is accurate so people can make good decisions. So I can remember when I was, again, doing my thesis, there was a situation where there was a nurse practitioner that told a young person, if you quit drinking now, your baby will be fine. And it's like, that's not an okay statement to make. We don't know that baby will be fine. This is 5 months in, and this woman was heavily addicted, right? So the chances of impact are pretty darn high. And I don't think it's fair to, yes, it is motivating, like it's important, and it's, the sooner you learn of the pregnancy and the sooner you stop, the health outcomes will improve. So I'm not here to say that every child exposed to alcohol is going to end up with FASD. That's not true. But we do know that there's impact on cell development, and it is a whole body experience. So to me, people need to understand that risk. And I don't think it's okay to say, yeah, if you stop now, you'll be all right, or a drink a night is okay. And I had a person who came through the clinic that her doctor said, yeah, a drink a day is absolutely fine. Well, for any of you guys who have teenagers out there, you tell your kids that they can have 1 drink, they're going to have 2, right? You tell them they can have 2, you can pretty much count on it doubling. So if doctors say that 1 drink is okay, then we're going to assume that maybe more might be okay too, and that we're just being over protective of this kind of thing. But I just wish that people and practitioners could follow me around in a day where I'm supporting families and adults with FASD. And my youngest ever has been like 18 months old that I've actually been engaged in an assessment for, and my oldest is 75. So this is definitely across the lifespan, right? So and again, alcohol is not going away anytime soon. So when I was in Newfoundland presenting, there was a government policy person there that came and spoke to me afterwards, where they were talking about these new guidelines and the risks associated with even small amounts of alcohol consumption. And she was the one who said to me, she says, I'm kind of starting to feel like guilty. Like I went my whole life when my kids were growing up and throughout my pregnancy and growing up, not drinking, because there's a no tolerance around drinking and driving. And when you've got kids at home, you always are on guard, and you might need to go and do something. So I never drank. Now my kids are older and they're on their own, and I like to have a glass of wine right now. And now I'm feeling like I shouldn't be doing that, or I feel guilty, or I feel like people are judging me because I'm having a glass. And I've heard that a lot. So again, it's about informed decision making, but we have to be careful that in our efforts to be inclusive and our prevention efforts, we also don't want to push people away so that they don't even want to have this conversation, right? And so I just really want to share that, because we can put a conversation underground pretty quickly, and that's why people don't talk to us or come to us for questions around or concerns that they may have had around their substance use, right? So again, you know, it's important to share this information, but also not to make people feel bad for having an occasional glass of wine, particularly if they're not pregnant, right? So just how do we share this information? It's one thing, again, for me to go down the street and not put my seatbelt on if I have a sore stomach or whatever, and so I choose to not protect myself. But it's a whole other thing if I choose not to protect my infant, right? So I think those are also the kinds of conversations that we need to have to make sure that we don't push people so far away from us that they won't have the conversation at all. But I also think it's important for people to know that people do not recognize that alcohol is the leading preventable cause of death and disability and injuries and accidents and social problems. The cost to Canada is like, you know, outstanding, right? I mean, alcohol use in Canada, 16.6 billion, 5.4 billion of that spent in healthcare. And so along with, you know, going back to fetal alcohol spectrum disorder and misdiagnosed, I'm working with somebody, you know, or I have worked with many people who've been involved in the child protection system. And there are examples of, you know, people having a difficult time finding safe housing, especially for our young adolescents who are displaced. And the cost for housing and, you know, staffing to keep individuals relatively safe, which is not working, I might add, is adding up to like $60,000 a month in some cases. So the cost to, you know, the cost to alcohol and particularly around developmental disabilities is pretty phenomenal. So what can we do? I think we can do what we're already doing, but with more awareness of the complex nuances that can be related. So I encourage all of us to keep learning. The statistics and implications are staggering. I think we can be better at screening, assessing, identifying, and supporting the family to learn more and making proper referrals. You know, how would our parenting programs and child protection system look differently if we were able to see that this puzzling behavior is not a parental, not due to negligence, but it's because we're trying to parent this person with a developmental disability in the same way we would parent everybody else. And that just doesn't work the same way. So I'm hesitant to put much emphasis on facial features because fewer than 10% of people with FASD actually have them. The facial features can, and again, that's of the statistics that we know of, right? Which is less than half a percent in Ontario. So of that, fewer than 10% of them have the facial features. So it might even be less than that, right? But we also know that the prognosis is better for people who do have the facial features because, going back to my first little person, we know to support people differently when they look different. And so why does diagnostic clarity matter? It matters because the way we support somebody with a brain injury is different than we would support somebody with mental health condition. And when people miss appointments and when parents don't show up, or when parents have limitations around understanding the instructions on a medicine bottle, for example, or when they don't like to leave a message and they're hard to get a hold of, it might be because they have inconsistent memory issues and they get really high anxiety when somebody calls them and they don't know why or who's calling them for what reason. You know, so there's a lot of reasons why people do what they do, particularly and if their brain has very unique presentations. So complex neurodevelopmental disability does need to be supported differently. So I just want to quickly go through the strengths of individuals with FASD because they're lovely. Like, honestly, I'm so honored to walk alongside so many chatty, friendly, hopeful, caring, tolerant, hardworking, tenacious, you know, just resilient people, and so very creative, very artistic, and have such a strong desire to please and to do well. when we talk about the early years, however, there's a lot of overlapping characteristics. There's a lot of things here that when you look at them in and of themselves, they're not absolutely FASD related. But when you put a few of these things together, and when you see some of these things, let's not forget about the role of substance use, and that a highly sensitive, colicky baby, or somebody who's has difficulty going to sleep, or the parents struggle at feeding them, or when they have intense emotions, or they go from 0 to 60 really fast, or they're hard to soothe, or the kids are really busy and they have no fear. We've all heard about those aggressive kids that are really funny, or the kids that just run across the street or take off in the middle of a shopping mall. Those are not typical behaviors, actually, but we kind of normalize a lot of things that aren't necessarily typical. Our kids have a desire to learn, but often can't seem to remember or grasp it. They appear to be not paying attention, or not interested, or maybe even the L word, which I don't really like. That usually comes later, again, as the gap widens over the years. So a lot of these characteristics can be overlooked developmentally. I just assessed a little person, 2.5, just this last week, that literally drove an hour and a half to get to me. And so far the system has just said, oh, she'll grow out of it. Don't worry about it now. And the poor parents are like, this is not the way this is supposed to go. This is really, really hard. This is way harder than it should be to parent a little person. But our system is just sort of chalking it up to well, the parents are a little neurotic. The parents are overly concerned. This is a parenting issue. We're not seeing this at daycare. We're fine. But we have to listen to our parents. We have to listen and look really closely. But yeah, boundary issues. I've heard of people, adults, telling me stories of they themselves digging under the fence and taking off, or leaving school and them finding them 3 kilometers away from the schoolyard at 3 or 4 years old. Those things are not necessarily typical. And so again, school age and beyond, it gets a little bit more complex, the more intense the learning and the expectations grow, and they expand, obviously. But there's often a difference between expressive and receptive and complex languages, sensory processing difficulties. I've heard of people that, we always hear of natural consequences, and if he doesn't wear his coat and if he's cold, he'll remember tomorrow. But actually, lots of our kids don't feel temperatures in the same way. They don't feel the need to go to the bathroom in the same way. They often don't feel it until it's absolutely an emergency, last minute, which is why sometimes toileting or toilet training takes a little bit longer, and there's accidents well on beyond those typical years. Fine and gross motor skill impairment can be subtle, but can be really, really challenging. Obviously, the behavioral and the emotional and the social difficulties. These kids with FASD want to have friends so bad, but tend to get impulsive and react very quickly, and often overreact in tight quarters. And when they want something, they don't have the same understanding of what's mine and what I can take and what I can't. So sometimes things come home in backpacks, or that don't belong to them. There's a dysmaturity associated with FASD, repeating the same mistakes as people get older, money management, and just planning their day-to-day activities. Making a sandwich can be something that's really complex for kids who have executive functioning difficulties, and adults. Very literal thinkers, so sarcasm and typical ways that we tease people can often leave people feeling very confused and unsure. So, and again, I want to say intergenerational, because this does happen a lot of times, and the people that we're seeing for concerns around the kids, often the parents are experiencing these difficulties too. So I'm realizing it's 2:50. Let me just see what else I wanted to go through. Yeah, I think I rushed through those last few, but let's open it up to see if there's any questions, or if there's anything that I can offer for clarification.
Sure. Let me, given people permission to unmute themselves. Oh, wait, no, I haven't. pardon me. And you're welcome to come on camera if you like. If you have a question for Angela. I do have a question here in the chat from Chelsea. Says, could you speak more about breastfeeding and alcohol? What kind of research has been done around that? And are there any sources you can share?
I don't have anything really handy right now, but I just shared some information just very recently. Health Nexus has some, like the Best Start program has some. There is, alcohol will go through breast milk. There's some actually some testing you can do now that will test your breast milk to see if there's alcohol a part of it. There's things like pump and dump, to get rid of the alcohol. There's timing that should be considered if you do want to have a drink. So, 2 hours before the next, but I mean, it just depends on how much you drink. So I don't want to give any information around that, but there definitely are some guidelines around, because one drink takes, I think, 2 hours to get out of your system, but 3 drinks takes like 6 hours to get out of your system. So it really depends on how much you're consuming, when you're consuming. But, the guideline is to try to avoid it if you can, or to supplement, to make sure that you have your own stash of milk available for the baby in the event that you do have a wedding or a special occasion that might involve alcohol use. So we know that alcohol, I mean, that's why we say to people, don't drink alcohol before you're 25, because your brain is still developing. So although it doesn't go as direct as it would throughout a pregnancy and right through the placenta and through the whole baby's body, it does get filtered through the mom and through the baby's blood system and liver, but it still does go through and affect the baby's development.
Thank you, Angela. Lee is asking, if there are adult participants we are serving who we suspect may have FASD, are there resources for them, and how do we help them obtain an assessment?
That's very community specific, and I'm here to sadly report that there are not a lot of diagnostic services available for adults. But I would say that if you think that your parents are struggling with a complex neurodevelopmental disorder, then it would be helpful, if at all possible, to get a psychological, like a neuropsych or a psychological evaluation to test if you have real concerns. Sometimes, and if this has been longstanding, which it has to be if it is FASD, so a history, like ask questions around, what was school like for you? What were your teenage years like? Those kinds of questions around academic achievement and maybe some skills or some areas of challenge. So if you do some screening, which is more than just what I'm able to share with you right now, but if you do some screening and you think it looks like it could be FASD, then sometimes a referral to Developmental Services Ontario will prompt, if there isn't a psychological evaluation already, there would be one available down the road, not like tomorrow or anything, but it would get the ball rolling to getting some of that diagnostic clarity. Like I have somebody right now that's in her 50s that's just getting ODSP and Developmental Services Ontario, and typically has been really just kind of struggling, but falling through every crack imaginable in our system. And again, with other systems in place like child protection, early years, that kind of stuff with her first, set of kids. And now she's got a second set of kids, and really didn't understand that she had something pretty significant going on. So I don't know, I hope that answers, but I feel like if we think it is, then we need to realize that, we need to remind people, we need to go a little farther with how we make accommodations and make the support services that we already offer more accessible to them as we build these assessments over time.
Thank you, Angela. And Lee has given her gratitude in the chat as well for your response. Any other questions for Angela before we wrap up and do our book giveaway? I'll join you on camera here, Angela. Oh, I'm all dark there. Any other questions for Angela? Okay, well, thank you so much for those questions. Oh, here we have Maureen joining us. Hi, Maureen. You have a
I don't have a
question?
question. I was just coming on screen.
Okay, hi, nice to see you. Welcome.
Thank you.
Okay, well, as I mentioned at the beginning of the session, and Angela has a book, I believe, Angela, it's called oh, good, you've got a copy to show us. Oh, can't quite see it. So complicated, oh, there we go, a complicated and beautiful brain. Wonderful. And so I jotted down a couple of, is there anything you want to say about your book before we give it away?
Just wanted to say that there's like QR codes that are put in throughout it, so you can dig a little deeper and build, you know, your knowledge base on the research that backs up what it is I'm saying. So it's helpful to some people.
Yeah, for sure, for sure. Okay, so I have a couple of stats probably from earlier on in the session. We'll see if we have anybody who has the right answer. And I guess the first person who is able to put it in the chat. So the first question is that you told us how many drinks qualify as a binge drink earlier on in the session. So do people remember? Yeah, it was 4. And in my chat, Maureen, you're quickest on the draw there. So I need my pencil here. So Maureen will get a copy of the book. Excellent. Congratulations, Maureen. And I see lots of right answers in there. Lee and Tim and Cindy were remembering. In addition to that, you said that at least the common understanding was that if a person engaged in 2 binge drinks during the pregnancy, that would have the serious implications for the health of the baby. And then a binge equaled 4 standard drinks, and you qualified to say that might not be the amount of alcohol you get at a restaurant, for instance, right?
It's 2 binge drinks or 7 drinks within a week too. So that's like if you have a glass of wine every day, that qualifies. Yeah.
The other stat, you talked about prevalence rates, and that we've acknowledged and adjusted that we've gone from 1 out of 100 to now the number is more 1 out of how many? And I'm seeing Chelsea R. That's the number I was going for. 1 out of 25, right? Is sort of at this point the current understanding of prevalence rates.
Yeah.
That's thank you, Chelsea. I don't could you maybe text or message me your last name so that I can find you and follow up. So congratulations to Chelsea and to Maureen for each winning a copy of Angela's book. And with that, I guess I'd like to then just begin to wrap up and make sure what sort of opening it up to one last chance if anybody has any comments or questions. But generally, oh, I see there's a question here from Cindy that I missed saying, can a child still suffer from FASD if the dad was drinking, or is it just linked to the mother's alcohol consumption?
So the term FASD, as we know it and understand it, results from prenatal alcohol exposure directly from the mom. However, we do know that dads have a role to play and that epigenetics is a thing. And we are even seeing, you know, signs and symptoms of FASD where the pregnancy has not been exposed, but the mother had been exposed. So the mother had FASD, or the father has had FASD. Some of those, like our genes are impacted and our genes get passed down. So so we are seeing, but fetal alcohol spectrum disorder, as we know it right now, results from direct pregnancy exposure. But I really, you know, I appreciate that question, because we do know that it's a family relation, you know, it's a family situation. It's not just the mom that's to blame. And we know that moms will drink less if dads drink less also. We know that this is all, and so to me, it softens it a bit when we know that dad's sperm does make a difference. If there's alcohol consumption, the risks of FASD are higher when dads are involved in that as well.
Excellent. Thank you for the question, Thank you for the answer. And Angela, thank you so much for your time today, for sharing your wisdom and obvious passion for this topic. I know that definitely got me thinking about things in a different way, and certainly we will. We've recorded this session, so we'll make that recording available to our other network members who weren't able to be here today, and share out your contact information as well, like your website, and people can find out more about your practice and certainly information about your book there as well. Yeah.
Thank you so much. We're doing lots of creative things, and if you want to check out the website, I do have a newsletter that goes out every once in a while that shares some of the things that we're doing, and we are really focusing on, addressing some of the gaps and yeah. So anyways, I appreciate the time very much.
Is it angelageddes.com? Is it your name.com, if I remember?
Yeah, so just angelageddes.ca if you go there.
Excellent.
And then there's a little contact button or whatever if you do want to get newsletters or anything, or listen to my podcast. And as always, if you have something to share with me, a question, a topic area, or something that doesn't make sense to you, and any feedback for those of you who won the book, I'd love to hear what you think of it. So yeah.
Great. Thank you, Angela. Thank you, everybody who joined us today. And I look forward to connecting again in the future.
Lee just put my my website on the chat, so thank you for that. I guess I could have did that too. But...
Yeah, me too. Thank you, Lee. That's much appreciated. So take care, and yeah, we will be in touch again soon. And thanks again, Angela.
Okay, thank you. Take good care. Oh, I forgot to say that the books are available in bulk too. Like if you have, like, some people are buying them for their parents. And the book is written in a way, like, I've had people with FASD read it and literally weep, saying, I see myself in those pages. I finally, feel like it's not my fault. So it's not like a hard textbook, it's written in a way that I was mindful that people might have it themselves. So there's no stigma or bias attached to it,
That's great. I look forward to reading it very much.
Sorry. Yeah.
Thank you. Take care, everybody, and goodbye.
Bye.